Welcome to the deep dive. Today we're looking closely at prostate cancer. It's something that affects, well, a lot of men. And we've got some information here that, honestly, it kind of challenges how we usually think about a cancer diagnosis.
Absolutely. And the numbers themselves, they're pretty stark right off the bat. About, 1 in 6 men will be diagnosed with it in their lifetime?
1 in 6. Wow. That definitely gets your attention.
It does.
But then, this source we looked at points out something, well, surprising. It says these cancers usually aren't life-threatening. Okay, hang on.
Right.
That's a huge difference from what pops in your head when you hear cancer.
Exactly. And it goes deeper. There's this least risky form of prostate cancer that's actually pretty common as men get older.
Okay, the least risky.
Yeah, and the key thing is this type. It doesn't spread, it won't metastasize, and crucially, often doesn't need any immediate treatment.
No immediate treatment for cancer. That almost feels wrong to say.
I know, right?
So you're saying a whole bunch of men get this diagnosis, but for many it's more like watch and wait, something you just monitor with your doctor.
That's pretty much the crux of it, yeah. And this leads straight to a really fundamental question. The source asks it directly. So, should it even be called cancer?
That's a heavy question.
It is, because think about how loaded that word cancer is. The instant anxiety it triggers.
Totally. Fear, worry, it all comes flooding in. So if there's this type that's low risk, slow growing, doesn't need intervention right away, is the label itself causing more harm? Like unnecessary stress?
That's a really valid point. I mean, what's a diagnosis for? It's supposed to guide treatment, right? Tell you what to expect.
Yeah.
So using the same word for conditions with such wildly different outcomes, maybe it is a bit misleading.
So what we're really digging into in this deep dive is this big difference within prostate cancer diagnoses. We're definitely not trying to downplay the serious forms.
Not at all.
But we want to highlight that, a diagnosis isn't always the worst case scenario.
Yeah.
A big chunk of cases are actually in this lower risk zone.
Precisely. It's about understanding the spectrum. Not every diagnosis is created equal, and the words we use, well, they have a real impact on how people feel, the choices they make.
That brings up something interesting for you listening, actually. If we did start thinking differently about labeling these really low-risk cases, what happens then?
Yeah, what are the ripple effects?
Right. Like how might it change screening? Or how doctors talk to patients? Our whole view of men's health, maybe?
These are such important questions. If the term cancer itself might be causing extra distress for something that might never actually be a threat, it really forces you to think critically about how medical info is shared, how we even define disease. Okay,
so the main takeaway from our chat today, it's that a prostate cancer diagnosis isn't just one thing.
Definitely not uniform.
Right. A significant number point to a low-risk situation.
Yeah.
Maybe no immediate treatment needed. And the source really pushes us. Is cancer even the right word for those cases?
Exactly. That core question about the definition, it's worth mulling over. It just highlights how vital it is to get the details, talk openly with your doctor, really understand your specific situation.
And that kind of leaves us with a final thought for you. Just think for a moment about medical language. It's meant to clarify, right?
Supposedly.
But it can also really shape how we feel. Maybe even ramp up our anxieties about health, especially when a common thing like this can range from, something minor to something very serious. The words matter a lot.
They really do.
Thanks for taking this deep